This next panel is going to focus on food as medicine. And our three panelists help us understand how entrepreneurship plays a key role in this. And so you'll see this as a theme through all of our panels is how do we think about something that's emerging? How do we take something that nutrition science and research is pushing forward? And then how do incredible entrepreneurs take that research and turn it into action and turn it into scalable products and really create impact and move new markets, right? So we're gonna have Dean Mozaffarian come back and moderate a conversation with two incredible female founders of companies. And they're gonna tell you about themselves. You can read their bios in the program. But I'm going to turn it over to Dari, who's going to have a conversation with these amazing women. Yep. And I will sort of move towards you when we're at time. Okay.
So, for this entrepreneurship summit, our goal is to focus on and shine a spotlight on some early stage innovators and what they're doing, alternating with scientific talks as the one you just heard. And so the panel here is on food as medicine. Again, bios are in your program, so I'm not going to go into detail in bios, but I have Rebecca Parekh, co-founder and CEO of The Well, and Michelle Rager, VP of Clinical Nutrition at Season Health. And so, the first thing we want to talk about is just sort of the concept of food as medicine and how that concept has become integrated into their kind of personal journey of their company. So Rebecca, tell us a little bit about what does food as medicine mean to you in your entrepreneurial journey?
Absolutely. Hi, everybody. And thank you very much. So excited to be here. So food as medicine has really shaped and defined my life, I would say, since the minute I was born. My mom has been an advocate for food policy and food as medicine since my earliest memories. And I really grew up around holistic health and valuing holistic health in a truly integrated way. My mom was teaching yoga when she was pregnant with me, so I've truly been practicing my whole life. My great-grandfather is an Ayurvedic doctor, or he was, and he was practicing a system of medicine that just really spoke to me and that I sort of understood at a very young age. My mom studied environmental science, and she was passionate about organic farming at a time that it wasn't easy to source organic produce in the community where we grew up. So we were eating almost exclusively vegetables grown in our backyard. And that was just a big part of my upbringing. We truly had laminated posters in my kitchen that warned us of the dangers of preservatives and food dyes and things like aspartame, which sparked an interesting conversation with the group yesterday on artificial sweeteners. So I won't double click on that. But in any event, I think that what I found is that as I navigated a teenage sort of period of developing an eating disorder, food became the devil for me and it became an enemy. And I, after an extensive inpatient hospitalization for anorexia, found my way back. And I had a really sort of full circle journey with food and the nourishing aspects of food in terms of the actual nourishment, but the community, the celebration of breaking bread and sort of allowing food to be sustaining. And then I carry that through my work and what I do. So fast forward, founded The Well in the fall of 2019. The Well is your one-stop shop for wellness. It's a truly integrated system. We bring together functional medicine doctors, Ayurvedic practitioners, Chinese medicine doctors. We develop need state protocols looking at gut health and sleep and immune health, anxiety, stress management, and we draw upon best practices across modalities. Food is one of the most important parts of this integrated offering, and it's really where we start. We run a restaurant, and we're very committed to food sourcing standards and education around the types of food we cook and why. We try really hard not to be dogmatic, not really trying to tell people what to eat and what they should eat. We're trying to invite folks to explore what works best for them, both culturally, emotionally, physically, providing diagnostic tools for folks to learn about how their body responds to different foods and opportunities to go deeper on that, but not trying to say, this is right, this is wrong, this is the way to eat, this is not. So that's my
terrific.
Journey in a nutshell.
And in just one sentence, you founded in 2019, COVID hit in 2020. How are you doing? What's the stage you're at? You're based in Manhattan. Just one sentence on kind of where you are now.
Yeah, so we opened our first location. So I quit my job. I used to work for Deepak Chopra, and I, had coffee with him in 2015 and felt like I really wanted to pursue this desire to found The Well, really as a consumer looking for something like this. So it took from, raising our first dollar in 2017 to signing a lease and opening our first location in 2019. We were open for 5 months before we closed for COVID. So that was a very challenging time to navigate. We were closed for 13 months. We have a product line as well. We have vitamin and supplement products and body care products that we use as part of our spa business. So we very quickly launched a direct-to-consumer business in early 2020 that wasn't planned or anticipated. So that did allow us to have some sales and some growth and sort of relevancy in folks' inboxes. And we did as much as we could online, trying to create opportunities to support our community, our colleagues, each other. We reopened in April of last year, so it's, as of last week, officially 1 year that we've been open again. And we now have 3 locations, 4 more underway that are opening in the next 12 months. We're building residences and a hotel, so a lot of growth in the last 2 years.
Terrific. So there is a market and a response and a need to this food as medicine. So Michelle, from the point of view of Season, your own journey, and maybe also, if relevant, a little bit of the founder's journey as well. Tell us about Season and food as medicine.
Absolutely. Well, I've always loved food personally. Always knew that I wanted to be involved with food as I was growing up. My background is as a registered dietitian, and so I started out my journey in a place where many RDs do, which is in a hospital setting. And you know, I just had a moment where I had seen my 10,000th person in the ICU after they had had something really terrible happen to them. I had 5 minutes to give them a diet education and give them a handout and send them off. And I just thought there has to be a better way. There has to be a different way that we can make an impact. And that just really got me thinking, you know, how can we be more proactive in the community? How can we look at food as medicine in a different way? Enter nutrition and tech, my journey with Season. Season is a digital food pharmacy, so we're looking at taking that nutrition prescription through to grocery order fulfillment, delivery, prepared meals, connecting it with all the ways that people eat in the real world. And for me, it's really about, you know, taking that approach of food can really make an impact, but finding ways to keep it individual and also scalable.
And same follow-up question, just in one sentence. Tell us a little bit about your latest round of funding and also any healthcare partnerships, ongoing projects you have going on.
Yes, well, we've been so fortunate. We just raised a Series A with Andreessen Horowitz leading that series. Done with the Series A for now.
And that was $34 million. That's a pretty impressive Series A.
Mm-hmm. And we are very excited. We've been able to partner with a couple of major healthcare systems, payer providers. So Geisinger is one of our partners. If you're familiar with Geisinger, they've pioneered the fresh food pharmacy idea. We also are working with Common Spirit to kick off a major pilot study. So those clinical trials, that research that we know is so important. And then we're also partnering with Cricket, kidney care company that also, you know, just had a successful merger. And so, you know, we're so excited to be looking across all of these chronic conditions and ways that we can potentially make an even bigger impact moving forward.
And healthcare is really the market for many of these, the buyer for many of these potential interventions. And just to put it into context, the state of Massachusetts has a waiver to test nutrition interventions in healthcare in sort of pilot studies. It's a $149 million pilot study. The state of North Carolina has one that is just recently getting started. It's a $650 million pilot. And the state of California just got theirs officially approved in December. I don't know the dollar amount. I'm sure it's over at least as big as those. And so $650 million in healthcare is a pilot study, right? And so that's the kind of money we're spending on healthcare that's going to drugs and devices and surgeries and hospitalizations that could be at least partly used for food. And so thinking about that, both of you, and this may be the last question for time. I'm not sure, Katie, will keep us on time. How do you think about equity in these areas? How do we ensure everyone needs better nutrition for sure, but how do we ensure that the most disadvantaged populations, those who have, you know, labored and struggled under structural racism and other challenges, whether it's in the U.S. or outside the U.S., but for both of you here in the U.S., how do we ensure that they also receive some of the benefits of your innovations?
Yeah, sure. I think, you know, obviously this is a very timely topic. It's a very challenging topic to address. In the past, I would say lots of us have approached it in a very one-dimensional way, which is maybe thinking just about cost or, you know, how we can make an impact there. at Season, we're thinking about definitely the cost of food, but we also think about access in other ways. So, not only making sure that people have access to food, but also thinking about how can we use fintech to make sure that we're tying together all the possible places that people might have food benefits available. We know that sometimes that can be very, very difficult to navigate. We're thinking about how we can make those recipes culturally relevant, so partnering perhaps with local chefs to make sure that we're really on point in terms of foods that people want to eat, that are delicious, and that they can identify with. We're also using our AI to filter in many ways the foods that we're presenting to folks so that we make sure that it's the best possible match for them and that they're the most likely to feel like, hey, I can do this, I can eat this, and it's sustainable for me.
And have the healthcare partners you're working with, is there a focus on particular Medicaid or low income or other populations from their perspective?
Yeah, I mean, I think, starting from the place where the payers are right now and what type of reimbursement, of course, those polychronic conditions are a place where we're starting. Dual eligibles, is a big place in the market.
Those are low income Americans who are over 65, so they're eligible for both Medicaid and Medicare, dual eligible.
We're also seeing a lot of special supplemental benefits in the chronically ill, so that would be in the Medicare Advantage population as well.
Terrific. Rebecca, same question.
Yeah, so a couple things. I agree. I think it's something that we talk about a lot and think about a lot and are evolving in terms of how we approach. And I think number one is we spend a lot of time working with and partnering with community leaders to listen and better understand what we can do more of, as opposed to sort of like coming out with one, as you said, sort of one-dimensional idea of like, this is how we can contribute. So part of it is just constantly being in conversation with community organizers and leaders and folks that we've built relationship with. I think, we spend a lot of time putting out editorial content and education that we offer to our community free of charge, aggregating information and data from clinicians and doctors and researchers, trying to sort of create like a framework for functional health and things that, there's just a lot of noise out there. So we try to be really thoughtful about the type of content we put out and sort of how we make that content available. We put out summits. So like the food summit that we did together last year, Dario was kind enough to lend his time along with several other thought leaders, and we had about 1,000 folks that joined. And what we did is we brought together thought leaders in the food science and food as medicine space, and we paired them with NGOs and organizations that are doing work in the social justice and food justice and food equity space, and we put together action plans for participants to directly connect them to organizations and sort of get involved directly. And sort of that was something that came out of conversations with some of the organizations we partner with who felt that that would be an effective way to connect some dots. The payer plan, the insurance system is definitely something that is a big challenge. Our services are not, accessible to all, and, I'd be misleading if I implied that they are. We do try to look at entry points. So, you can come to the WOW and take a $20 meditation class and you're welcome to spend the whole day. You can steam room, sauna, restaurant, cafe, library, reflexology, lounge. There's no access fee, there's no membership. So we try to make what we do as accessible as possible to our community. We're limited by virtue of where we're located. We're on Fifth Ave in Manhattan. We reach a very small percentage of the population. So we think a lot about systemic change. We think a lot about insurance. There's such strong data that exercise is, as effective for forms of mild depression as some drugs, but your Lexapro script is covered and your yoga class is not. So how do we solve for that? And how do we create a standardization in the fitness community to have some of the services that we offer, yoga classes, meditation classes, massages, energy healing modalities, something that, the founder of Aetna is really passionate about craniosacral and energy healing, and Aetna is starting to reimburse functional health in a way that other payers aren't. So trying to be a part of that conversation and, just getting sort of more thoughtful reimbursements for services that we offer. And lastly, participating in forums like this. I mean, as Dari shared earlier, we met in an airport with a 9-hour delayed flight 7 years ago, and I'd had the privilege of hearing Dari speak at a healthcare conference in Colorado, and I was so excited and inspired and grateful that I was invited to participate in this forum. And looking around this room and the conversations that we've had over the last several years, seeing the actual impact of the funding and the White House papers and the white papers and the work that's being done really is catalyzed by Dari's vision, I think is sort of systemically how we approach change in a way that is most effective and addresses equity and access.
Well, I think that's terrific. And from what you just described of what you can do in a day at the well, I think I want to go for a day and spend my day there.
I think we should all go for a
sounds
day.
really nice. Yeah. I think that these journeys and this interest in food as medicine is growing tremendously. And even here at Tufts, we've been in talks with Tufts Medical Center and Cam and Paulina Neely. Cam is the president of the Boston Bruins. They're very, very interested in nutrition and integrative care for cancer, for autoimmune and inflammatory diseases. How do we create a center for nutrition and integrative care at Tufts, which centers the science, the teaching, the research, puts nutrition at the forefront? And so as we move on that journey, we're definitely going to be tapping on both of you for working with us and helping to build that, here in Boston and nationally and internationally. So thank you so much for a terrific panel. And do we have time for any questions?
We have time for questions, and we have questions. Online, there's several questions that have come in. One of them is a question for both of you, which is, what opportunities did COVID-19 give you? We know all the challenges it presented, but as entrepreneurs, were there opportunities that came out of COVID-19?
I can fill that one first. So, season started just a few months before the pandemic hit, and we were all, grounded. And I think what we really saw come out of it is, of course, the rise of online grocery use, an opportunity to really take advantage of that, to be able to, again, connect people with those foods, get them delivered to their door, and to have a significant proportion of people buy into that as an option. Also, obviously, the rise in telehealth. I have a friend who works for a major health payer, and she said, their tech department was devoted to maybe 5% of building out their telehealth platform for the health plan prior to, and now it's something like 60 or 70%. So, we've seen it grow in leaps and bounds. I think there's lots of opportunities. Still a lot of challenges there in terms of access and making sure that everybody has equity. But I think, that's been the biggest thing for us.
Right, Rebecca?
I think that the whole world sort of coalesced around this idea of wellness and well-being for a period of time. And I think it really shone a spotlight on much of what we, had been advocating for and passionate about prior to COVID. We look at the anxiety and depression rates and the mental health crisis that we're navigating right now. And it just has sort of crystallized this need to have, not nice to have. We're working with a lot of corporations who are approaching us and asking us how we can support employee well-being and team member well-being. We're hosting, corporate events where we're doing tapping sessions and EFT and sort of things that are, having an...
Or tapping sessions in EFT?
So tapping and EFT, so tapping is literally tapping. And so there's a system, it was developed by a kinesiologist, and basically it's sort of tapping into different energy meridians in the body. And there's data that shows, and Qigong is similar. We have a lot of these sort of energy healing classes in the realm of energy medicine that have just an immediate impact on your nervous system. And so folks who are in, the throes of a panic attack or chronic anxiety or not sleeping, we put together these toolkits where we teach folks the sequencing for tapping, and we can do that virtually. We do group acupuncture. So, a lot of folks are intimidated by doing like a deep, lengthy medical evaluation. So we do just community circles with sound baths and sound healing, and group needles is just sort of like a way and an opportunity for folks to reset. There's also a lot of physical therapy needs that have come out of COVID, folks just sitting at desks all day or sitting at home all day. So that's a big piece is pain management, posture lab, things like that we've developed. But I think the biggest thing, as I mentioned, folks have coalesced around this idea, early on in COVID, I think we were all talking about metabolic health in a way that was like really powerful and clear and important for us to understand, comorbidities and the existence of this sort of chronic health pandemic that predated COVID and the intersection of those two and the negative health outcomes. There was such an interesting piece in the Times last week on obesity and type 2 diabetes, specifically in COVID outcomes, which I'm sure you probably read. So I think it's just been like really good material for folks to dig into and realize that we have to really pay attention to this for like population health.
Yeah, that's interesting. I love that the glass isn't half empty. We're making lemonade out of lemons for sure. Michelle, you should know there's someone in the audience who LOVE capital letters season in your ideas, which is fantastic. They said, can you divulge the health systems that you are working with?
Yeah, so the ones that I mentioned are the ones that we can divulge for right now. We've got others in the pipeline. So Common Spirit is one of our partners, Geisinger Health Plan, and their corresponding health system, and then also Cricket.
Okay, perfect.
But I think, just a short note on that, Katie, I've been working in tech for 7+ years now, and I think people have always been willing to talk about food and nutrition and how it can make a difference. Now I think is the time that we're finally starting to see that interest connecting with the ability of payers to make that happen and make the reimbursement happen. So it's so exciting because it's no longer just interest. People are actually finally coming behind it and rallying behind it.
Yeah, 100%. The innovations and watching all of the infrastructure, the ecosystem move with it slowly as it is happening. It is happening. Do we have questions in the audience? Just want to make sure, because I have another online question, but I just want to make sure I'm not missing anyone out here. Okay, so the other question I had, Rebecca, is for you, and makes our last question, is asking about the type of quality assurance that you have to do with testing when you're offering products to the public. What type of quality assurance testing do the supplements and things that you go? Is it independent, third party, or you do this in-house is the question.
Such a great question. And we think of quality assurance both in terms of our product line, but as well as the services that we offer too, and sort of quality and standards around treatment modalities. So on the product side, we formulate our own blends and products for self-care. We work with a bioalchemist that develops the scent profiles for our essential oil blends. And we use, different carrier oils, avocado oil, almond oil, et cetera. And we blend and formulate and package that ourselves. And they're used in our bodywork treatments. On the vitamin side, we partner and we white label with a manufacturer. So we did a lot of research early on with brands. There's a handful of brands that are sort of historically been to the trade medical grade supplements that are now more available direct to consumer and through retailers. Our chief medical officer is someone named Frank Littman. He's been practicing functional and integrative health for 40 years. One of my favorite quotes of his is that he went from quack to guru over the last decade. And so he's very smart. He's very thoughtful. He's spent his life sort of researching and thinking about supplements. We're really careful. We are not trying to over supplement. We are like very food first and sort of think about, when we talk about supplements in the context of gut health, we talk about supplements in the context of nutrient erosion in soil. So we try to give context. The same with testing. Functional medicine often gets a bad rap for over testing. We try to, as Frank often says, we treat the patient, not the test. So sort of thinking about some of those things. But back to the quality control, I think it is important that we have a white label partner on the supplement side. And we have a really, really robust training program in terms of our services. And it's one of our biggest challenges. We have a very high touch model and it's hard to scale. In order for us to reach the quantity of folks that we want to reach with the standard quality that we're committed to, it's tough. We have multi-month training programs for our services.
The entrepreneur's journey is not an easy one. And so I applaud both of you. Dari, thank you so much for moderating this great panel. Thank you so much to both of you for joining us today.